Hey, it's Laura from Train to Respond. Today I'm going to be talking about you've called 911 for a medical or traumatic emergency. Now what? What can you do to help prepare for first responder arrivals? And there's some things we'd love to see. As a paramedic, there was nothing more I loved when I walked on the scene, especially of a medical emergency, to have somebody, a family member or a friend, hand me a sheet of paper that had this information on it. Whether it was handwritten, typed up, we had some folks that typed things up. That just helps us form a better clinical impression of what's going on, helps us speed up treatment and help your loved one quicker. So here's some things we'd love to see as first responders. So patient's full name, their age and date of birth, and then do they have a DNR, a living will, or a POLST, a P-O-L-S-T. And I'm just going to read to you what a POLST is. And this is from polst.org. So this is honoring the wishes of those with serious illness and frailty. It's a portable medical order, and it communicates the wishes of the person as medical orders for those of us who are on scene. And it tells all healthcare providers during a medical emergency what the patient wants or what you want. So it can say, take me to the hospital, or I want to stay here, I don't want to be transported to the hospital. Yes, attempt CPR, or no, don't attempt CPR, and that can fall under the do not resuscitate order as well. These are the medical treatments I want. This is the care plan I follow. The POLST is for seriously ill or frail folks. That's what a POLST is. So here's the thing with these medical orders, is a DNR or a POLST. So if I get called to a scene where somebody is in cardiac arrest and a family member goes, oh no, they have a DNR, we don't want anything done, and they can't physically produce that DNR for me to read, by law I have to continue CPR. So it's very, very important that if somebody has a DNR or a POLST, that's on scene with them, a copy of it or something for the first responders to read. We want to honor your wishes. We want to honor the patient's wishes. If we're doing CPR and you provide that DNR to us or that POLST, we can then stop and we can do a pronouncement. So it's very important. Please have that DNR, because we don't know what's going on behind the scenes. It could be that a family member's in the will and they want this person to be pronounced or pass away, or they don't like them. There's a whole bunch of things we don't know about. So legally, we have to continue resuscitative efforts until we can see a DNR or a POLST that tells us how we should proceed. So please have that on scene. Next, what happened, or what's the person's chief complaint? Why did you call? And then tell us the story. I like to call it, paint me a picture. Tell me a story of what happened here. And we get this story from the patient, from bystanders, from family members, and we can get it from the scene as well, looking around a scene a lot. We can pick up a lot from that. And that helps us, again, form that clinical impression of what do we think's going on here and what treatment path do we want to take for this patient. Get past medical history. So it's pertinent past medical history of something they've had in the past. There could be a heart attack, a stroke, something that they've had in the past that we want to know about. We don't need to know about they had their appendix taken out when they were 3. We want pertinent past medical history. Also current medications, and that's current medications. So a lot of folks just save their medications, we find, and they'll just come out in a boom, this big bag or box full of medications that we now have to sort through to find the current ones they're on. So if you can have a list of all current medications, or even a box or a bag with just the current medications, and that's going to help speed things up. Because a lot of times the family might not know what their medical history is, but as providers we can look at the medication and get a good idea of what some past medical history is or why they're on that medication. And also allergies, super important for that. As paramedics, we are going to probably give a medication. And it varies from state to state what medications paramedics or advanced providers carry. But we carry a lot of medications, and then based on what our findings are, we're going to administer those medications. We never want to administer something a person's allergic to. That can be a tragedy in itself. So again, if you can get this stuff together while the first responders are on the way, patient's full name, age, DOB, DNR, living will, or POLST. Tell us what happened. Get that chief complaint. Tell the story. Paint us a picture. What happened here? get that past medical history, current medications, and allergies. And a thing that we also teach, we're teaching everybody this. We're teaching all first responders this, and we're teaching immediate responders. And immediate responders are now classified as the civilians who have been trained either in bleed control, active shooter, and something medically that they're willing to step up and help somebody else. They're an immediate responder. So we're teaching everybody this. So it's called SAMPLE, S-A-M-P-L-E. So SAMPLE is signs and symptoms. And a sign is something we're going to figure out. We can figure it out through the blood pressure, through the pulse ox, maybe getting a blood sugar. So that's something we're going to pick up on exam. And a symptom is something the person is going to tell us, the patient is going to tell us. And allergies, super important, as I said, especially if we're going to give a medication. But we also want to know, are they allergic to any type of food? Have they been stung by a bee and they're allergic to bees? That can help us figure things out as well. And then medications that they are currently on. So we want current medications. This can help us. If you don't know why they're on the meds, we can, as providers, say, oh, this med is for this med is for this situation or illness, and we can kind of figure out a little bit more if you don't know medical history. And then past medical history, pertinent past medical history. Next one is last oral intake or last meal. This can help us out. What if the person's unconscious? Maybe I can say they're diabetic. Oh, they didn't eat today, or they ate today and they didn't take their insulin, things like that. So we want to know that last oral intake, and can also help out a trauma surgeon who, you know, they're going to be doing surgery. Then I want to know what's in that belly that I have to manage during that surgery. And then last we have events. And that's, again, that goes up to paint me that picture. Tell me that story. What are the events that happened that you called 911 for? Having all this information ready for us is going to speed up and get your loved one help quicker, help us form that clinical impression and how we're going to proceed with treatment. In the Bleed Control Specialist Manual, there is a whole section on this. So if you already have this, it's on page 38, but it helps preparing for the arrivals of the first responder and all that you can do there, including sample. I'll try and get you a PDF that I can upload here on YouTube. So I hope that helps out. That'll certainly help out the first responders, EMS and fire in your area to help you get ready for their arrival should you be calling for a loved one or a friend who's suffering a medical or traumatic emergency. Have a great day.